prize or whatever you say for this workload. Thank you very much. Now I will start. I will say you can start your session. Sing, please.
Sir, smoking is a very important this addiction, and it is very common and the most common addiction that people are suffering. And Dr. Esham Mishra, and he's a very able person. He's a very well-known pulmonologist, and it is over to him to start the what is the smoking, what is the e-smoking, what is the hazards of this smoking on respiratory, cardiovascular, and other system, and how to do the cessation. What are the benefits of the cessations? What are the methods of the cessation? That is very, very important for this people, young people who are very much addicted to smoking. Over to Professor Dr. Esham Mishra, sir.
Thank you, sir. Thank you very much, sir, for giving me this opportunity. I want to pay my regards to Professor K. Tiwari, sir, and you for giving this opportunity on this very forum. As you have already told that this is a very important problem and we have to tackle with it. And Anandji, kindly, Anandji, hello, hello.
Anand, take care.
ओके सर, आप नेक्स्ट करते रहेंगे सर, हम बढ़ाते चले जाएंगे स्लाइड।
ओके ओके, अभी नहीं आ रहा है
स्लाइड तो आ रहा है,
नहीं हमारे पास नहीं आ रहा है, फुल स्क्रीन कर दीजिए। हेलो
सर, आप वहां से शेयर करना बंद कर दीजिए, हम शेयर कर रहे हैं सर, आप शेयर मत कीजिए।
हम नहीं कर रहे हैं शेयर,
आपका स्क्रीन से शेयर हो रहा है सर, वहां से हम बेस्ट ऑफ कर दे रहे हैं, हम कर रहे हैं,
कर दीजिए। थैंक यू। नेक्स्ट, first, what is smoking involves inhaling of and exhaling the fumes of burning plant material. A variety of plant materials are smoked, including marijuana and hashish, but the act is most commonly associated with tobacco as smoke in cigarette, cigar, or pipe. Tobacco contains nicotine and alkaloid that is addictive and have both stimulating and tranquilizing psychoactive effect. Next, the tobacco products are manufactured with various additives to preserve the tobacco's shelf life, alter its burning characteristics, control its moisture content, inhibit the hatching of insect eggs that may be present in the plant material, mask the irritative effects of the nicotine, and provide a wide variety of flavors and aromas. Next, please. The smoke produced when tobacco and these additives are burned consist of more than 4,000 chemical compounds. Many of these compounds are highly toxic and they have diverse effects on health. The primary constituents of tobacco smoke are nicotine tar, the particulate residue from the combustion, and gases such as the carbon dioxide and carbon monoxide. Next, please. The harmful effects of smoking are not limited to the smoker only. The toxic components of tobacco smoke are found not only in the smoke the smoker inhales, but also in environmental tobacco smoke or second-hand smoke. That is the smoke exhaled by the smoker, mainstream, and the smoke that arises directly from the smoldering tobacco. That is the side stream smoke. Next, please. As per the different studies, there are more than 1.3 billion smokers worldwide, and majority of whom 80% live in the low and middle income countries. Tobacco kills about 8 million people each year, including 1.6 million non-smokers who are exposed to second-hand smoke. Next, please. Approximately 40% of cigarette smokers will die prematurely due to cigarette smoking unless they are able to quit. Smoking leads to increased relative risk of major diseases. Next, please. And this slide shows the relative risk of different diseases in male and in the next slide in the female. Next, please. Next, please. And there are this slide indicates the relative risk of different kinds of cancers and different sex characters. Next, please. Next. Next, please. Male smokers smoke an average of 11.5 cigarettes per day, and female smokers an average of 9.5 cigarettes per day. Next, please. Tobacco smoke is an aerosol of droplets, particulate matter containing water, nicotine, and other alkaloids and tar suspended in a gaseous phase. Tobacco smoke contains several thousand different chemicals, many of which may contribute to human disease. Next, please. The particulate phase contains major toxic chemicals such as nicotine, benzoapyrene, and other polycyclic hydrocarbons, 4-methyl nitrosamines, butanes, nitrosamines, and nickel, cadmium, and arsenic and lead. Next, please. The gaseous phase contains carbon monoxide, acetaldehyde, acetone, methanol, nitrogen oxides, hydrogen cyanide, acrolein, ammonia, benzene, formaldehyde, nitrosamines, and phenyl chloride. Next, please. Smoke may produce illness by way of systemic absorption of toxins and or cause local pulmonary injury by oxidants and other chemicals. Next, please. Next, please. Tobacco is a major cause of death from cancer, cardiovascular disease, and pulmonary disease. And smoking also is a major risk factor for osteoporosis, reproductive disorders, and the fire and trauma-related injuries. Next, please. This slide indicates the different kinds of diseases which are caused by the smoking, that is the cigarette and cancer risk. Next, please. This slide indicates the different kinds of cardiovascular diseases. Next, please. This slide indicates different kinds of pulmonary diseases. And the next slide, please. This indicates the gastrointestinal diseases, the peptic ulcer, and esophageal reflux diseases and other reproductive disturbances that reduce fertility and movement, increase perinatal mortality, premature birth, low birth weight, orofacial clefts, abruptio placenta, spontaneous abortion, and ectopic pregnancy. Next, please. Orodental diseases, oropharyngeal cancer, leukoplakia, dental caries, periodontitis, and tooth staining. Next, please. Non-insulin, other diseases that includes non-insulin dependent diabetes mellitus, earlier menopause, osteoporosis and hip fracture, rheumatoid arthritis, age-related macular degeneration, poor wound healing, aggravation of hypothyroidism, altered drug metabolism or effects. Next, please. Next, please. Many chemicals in tobacco smoke may contribute to carcinogens as tumor initiators, carcinogens, tumor promoters, or complete carcinogens. Next, please. Complex of tobacco smoke carcinogens with DNA are thought to be a crucial step in cancer induction, and cigarette smoking uses a specific pattern P53 gene mutation associated with squamous cell carcinoma of the lung, head, and neck. The risk of lung and other cancers is proportional to the number of cigarettes smoked per day and even more strongly to the duration of smoking. Next, please. Alcohol use interacts synergistically with the tobacco in causing oral, laryngeal, and esophageal cancer. Next, please. The mechanism of interaction may involve alcohol solubilizing tobacco carcinogens or alcohol-related induction of liver or gastrointestinal enzymes that metabolize and activate tobacco carcinogens. Next, please. Also increases the risk for respiratory infections, including pneumonia, results in disability from viral and respiratory tract infections. Next, please. Next, please. The pulmonary diseases from smoking includes the overlapping syndrome of chronic bronchitis, emphysema, and airway obstruction, and COPD. Next, please. Kindly, next, please. Next. Next, carbon monoxide rapidly binds to hemoglobin to cardiovascular. Just go one back, kindly. Binds to hemoglobin to carry oxygen and impairs oxygen release at tissues. Thus, carbon monoxide exposure produces the functional anemia. Carboxyhemoglobin levels are typically 5 to 10% in smokers compared to 1% or less in non-smokers. Next, please. Cardiovascular disease is very common in smokers and is one of the most important risk factors. Next, please. This increases the coronary artery disease, sudden death, cerebrovascular disease, peripheral arterial disease, including abdominal aortic aneurysm. Next, please. The mechanism are different, and we all know how it acts in creating these diseases. So kindly skip this slide and go further. Next slide, please. Next, please. Next. Also produces insulin resistance and increases the risk of non-insulin dependent diabetes. It also induces chronic inflammatory state as evidenced by increased neutrophil count and increased C-reactive protein blood of the smokers. Insulin resistance and chronic inflammation contribute to accelerated atherogenosis. Next, please. After acute myocardial infarction, the risk of recurrent myocardial infarction is higher, and survival also decreases in persistent smokers as compared to quitters. Next, please. Also interferes with the revascularization therapy for acute myocardial infarction. After thrombolysis, the reocclusion rate is fourfold higher in smokers who continue than in those who quit. The risk of reocclusion of a coronary artery after angioplasty or of occlusion of a bypass graft is increased in smokers. Next, please. This increases the risk for respiratory tract and other systemic infections. Both active and passive smoking exposure increases the risk of infection. The mechanism by which smoking increases the risk are multifactorial and include structural and immunological alternations. Next, please. Next, please. Many of the immunological disturbances resolve within 6 weeks after smoking cessation, supporting the idea that the smoking cessation is highly effective in relatively short period of time in prevention of infection. Cigarette smoking is associated with an increased risk for bacterial and viral infection. Tuberculosis is perhaps the most important smoking associated infection. Next, please. This slide indicates the relative risk of different diseases in which the tuberculosis is the topmost. Next, please. Wound healing is also impaired in smokers. Cigarette smoking is a major cause of adverse post-operative event and delayed wound healing. The mechanism including cutaneous vasoconstriction, reducing skin blood flow, local thrombosis, and reduced oxygen carrying capacity, all of which can delay tissue repair. Next, please. Several studies conducted in different parts of the world indicate that smoking cessation substantially reduces post-operative complications. Next, please. The optimal window of a smoking cessation intervention may be at 8 weeks before elective surgery, as suggested by data demonstrating that patients who had stopped smoking at least 2 months pre-operatively had a nearly maximal reduction in post-operative respiratory complications. Next, please. Other complications of cigarette smoking are cigarette smoking increases the risk of duodenal and gastric ulcers, delays the rate of ulcer healing, and increases the risk of relapse after ulcer treatment. This is also associated with the esophageal reflux symptom, as already discussed. Next, please. Produces ulcer disease by several mechanisms, and one of them is increasing acid secretion, reducing pancreatic bicarbonate secretion, impairing the gastric mucosal barrier, reducing the pyloric sphincter tone, and increasing the risk of Helicobacter pylori infection. Next, please. This is risk factor for osteoporosis in that it reduces the peak bone mass attained in early adulthood and increases the rate of bone loss in later adulthood. Smoking antagonizes the protective effect of estrogen replacement therapy on the risk of osteoporosis in postmenopausal women. Next, please. Hip fractures are more common in women who smoke cigarettes. Cigarette smoking is a major cause of reproductive problems, including fetal growth restriction, with preeclampsia, stillbirth, perinatal mortality, and sudden infant death syndrome. Growth retardation from cigarette smoking has been named fetal tobacco syndrome. Next, please. Cigarette smoking causes reproductive complications by causing placental ischemia mediated by hypoxic effects of chronic carbon monoxide exposure, endothelial dysfunction, and the general increase in coagulability produced by oxidant chemicals in cigarette smoke. Other adverse effects of cigarette smoking include premature facial wrinkling, increased risk of cataract, age-related macular degeneration, olfactory dysfunction. Next, please. Smoking reduces the secretion of thyroid hormone in women with subclinical hypothyroidism and increases the severity of clinical symptoms in subclinical or overt hypothyroidism. The latter effect is reflecting antagonism of thyroid in action. Cigarette smoking also potentially interacts with a variety of drugs by accelerating drug metabolism or by pharmacological interaction that nicotine or other constituents of tobacco have with other drugs. List is given in the next slides. Next, please. What are the health hazards of the second-hand smoke? Next, please. Second-hand smoke consists of both of side stream smoke generated by the cigarette smoldering and of the mainstream smoke exhaled by smoker, as already discussed. Of the total combustion product from a cigarette, 75% or more enters the air. The constituents of second-hand smoke are qualitatively similar to those of the mainstream. Next, please. Next, please. However, some toxins such as ammonia, formaldehyde, and nitrosamines are present in higher concentration in second-hand tobacco smoke than in the mainstream smoke. Second-hand smoke have found to be associated with increased incidence of lung cancer, lower respiratory tract infection, aggravation of asthma, or atherosclerosis, thrombosis, and cardiovascular diseases. Next, please. This slide indicates the different health hazards of second-hand tobacco smoke in the non-smokers. Next, please. What is the electronic cigarette? This is the picture of the e-cigarette, and this indicates the different parts of the e-cigarettes. Next, please. E-cigarettes was invented by Chinese pharmacist Hon Lik, who initially developed the device to serve as an alternative to conventional smoking. And he thought that this will lead to the reduction in the smoking or cessation of the smoking. E-cigarettes are electronic nicotine delivery devices, heat a nicotine solution to generate an aerosol that is inhaled without the combustion of tobacco and its toxic constituents. Vaping refers to the act of using an e-cigarette, and different types of devices have been developed over the last few decades. Next, please. Different parts are of these cigarettes are reservoir, resistance, and metal coil, and wick. Next, please. Next, please. Other parts are the battery, and e-cigarettes were marketed with the claims of health benefits compared with the smoking cigarettes. They are marketed for use in reducing and quitting smoking, for use when person is forbidden to smoke cigarettes, and for avoiding generating smelly and irritating second-hand smoke. Next, please. At present, there are a number of e-cigarettes devices available in the market. The health effects of e-cigarette is not well established and is controversial. Next, please. Next, please. Safety of e-cigarette is a major area of concern since the devices have been subjected to only very limited safety testing, and there is little evidence to suggest that they are safer than regular tobacco products. Research has suggested that individuals who use e-cigarettes regularly are at increased risk of coronary artery disease, heart attack, and stroke. Next, please. Daily cigarette use is associated with changes in oral bacteria composition and oral inflammation, which potentially increases the risk of oral infections such as periodontitis, and which may risk factors for heart disease. It is also suspected that e-cigarettes use increase the risk of seizure, particularly in young individuals and persons who inhale large amounts of nicotine. Next, please. Research published in 2019 suggested that e-cigarette use is linked to heart metal pneumoconiosis, a rare lung disease caused by the inhalation of toxic metals. Different studies indicate that people who use e-cigarettes have a 71% increased risk of stroke and 40% higher risk of heart disease, heart attack by 42% as compared to non-users. Next, please. Vaping leads to popcorn lung, liquid pneumonia, and primary spontaneous pneumothorax. E-cigarettes leak toxic metals, possibly from the heating coils, that are associated with the health problems such as kidney disease, respiratory irritation, shortness of breath. Next, please. As per reports of a study conducted in Manchester University, fertility rates can also be harmed by vaping. E-cigarettes include many harmful substances that disturb hormonal balance and reduce the implantation of embryo in women. Vaping also negatively affects the structure and function of the sperm. Next, please. Vaping can impair prefrontal brain development, which can lead to attention deficit disorder and disrupt impulse control. Adult vapers are also more than twice as likely to be diagnosed as depressed than their non-vaping partners. Next, please. As per recommendation of American Heart Association, vaping should not be used as an aid in smoking cessation. Different studies indicate that most smokers who try to use vaping as a cessation aid simply become a dual users. The American Heart Association concludes the science clearly indicate vaping is not a safe or healthy alternative to the smoking. Next, please. Smoking cessation is a very important part, and this is the main theme of today's CME. Tobacco use is motivated primarily by the desire for nicotine. Drug addiction is defined as compulsive use of a psychoactive substance in which the consequences detrimental to the individual or society. Next, please. Nicotine is absorbed rapidly from tobacco smoke or e-cigarettes vapor into the pulmonary circulation. It then moves quickly to the brain, where it acts on nicotine cholinergic receptors to reduce gratifying effects within 10 to 15 seconds after the puff. Chronic exposure to high levels of nicotine causes an increased concentration of nicotine receptors in different regions of the brain, accounting for development of tolerance and intense withdrawal symptoms. Next, please. Nicotine has a half-life of approximately 2 hours. Nicotine from a smokeless tobacco is absorbed more slowly and results in less intense acute pharmacological events. With long-term use of tobacco, physical dependence develops associated with increased number of nicotine cholinergic receptors in the brain. Next, please. When nicotine is unavailable even for only few hours, withdrawal symptoms begin, including anxiety, irritability, difficulty in concentrating, restlessness, hunger, craving for tobacco, disturbed sleep, and in some people, depression. Addiction to nicotine is multifactorial, including a desire for the direct pharmacological actions of the nicotine, relief of withdrawal symptoms, and learned associations. Next, please. The smokers report a variety of reasons for smoking, including pleasure arousal, enhanced vigilance, improved performance, relief of anxiety or depression, reduced hunger, and control of body weight. Environmental factors and situations such as after eating a meal, drinking coffee or alcoholic beverage, talking on phone, or being aroused around friends who smoke often trigger an urge to smoke. Next, please. Compared to general population, it has been observed that smoking in 2 to 3 times more prevalent persons suffering from mental illnesses. It is particularly high among patients with schizophrenia, bipolar disorder, post-traumatic stress disorder, and alcohol, illicit drug users, etc. Smoking and depression are strongly linked. Next, please. Next, please. I have discussed in the next, please. There are neurobiological mechanisms of addiction. I already told nicotine binds selectively to nicotine cholinergic receptors in the brain as well as in the autonomic ganglia, the adrenal medulla, and the neuromuscular junction. The NACHR is a ligandated ion channel composed of alpha and beta subunits. Nicotine receptors in the brain have different chemical conductances for sodium and calcium and sensitivity to nicotine agonists. Next, please. Brain imaging studies in smokers have confirmed that smoking causes upregulation of the high affinity NACHRS receptors, which is maintained up to 4 weeks after cessation of nicotine exposure. The various nicotine receptors are believed to mediate different pharmacological actions of the nicotine, perhaps corresponding to multiple effects of nicotine experienced by human smokers. Next, please. Nicotine receptor activation facilitates the release of neurotransmitters including acetylcholine, norepinephrine, dopamine, serotonin, beta endorphin, GABA, and others. Pharmacologically, nicotine is a stimulant. It enhances fast excitatory synaptic transmission, which may contribute to learning and memory. Next, please. Nicotine also releases growth hormone, prolactin, vasopressin, and adrenocorticotropic hormone. Behavioral rewards from nicotine and nicotine addiction appear to be linked largely to dopamine release, which with an impact from GABA receptors as well. Nicotine metabolism can vary significantly among individuals. Next, please. Cytochrome P450 lysoenzymes impact the speed of metabolism and are categorized as poor, extensive, or ultra rapid. These differences can have an impact on smoking behavior and metabolism of nicotine replacement therapy. In addition, exposure to tobacco smoke has a wide-ranging impact on metabolism of many drugs. Next, please. Polycyclic aromatic hydrocarbons, products of combustion in cigarette smoke, upregulate certain CYP enzyme, primarily CYP1A2, and accelerate the metabolism of drugs that go through CYP1A2 pathway. Nicotine in tobacco smoke also has please, one back, please go back, one line, please. This slide indicates the different interactions of and how it affects the metabolism of the different common drugs. Most of these drugs has increased clearance. Next slide. These common drugs, amitriptyline, benzodiazepines, chlorpheniramine, clonazepam, duloxetine, all drugs, in some of them, there is decreased concentration due to the excretion, fast excretion or clearance. Next slide, please. These are the common drugs which are used in different diseases, and this is the anti-cancer drugs which are used, which can that's metabolism is also affected by the nicotine receptors mechanism. Next, please. Next slide, please. These are the common drugs which we are using every day, and the metabolism of these drugs are also affected by the smoking. Next, please. How we should approach. This is the most important part. Next, please. Approach for cessation of smoking may be non-pharmacological approaches, such as behavioral counseling, and secondly, the pharmacological approaches or the combination of the both. Next, please. Smoking should be regarded as a primary addictive disorder in contrast to habit or lifestyle choice, as generally classically considered. As per different studies, out of large number of persons who wish to quit, very small, that is about 1% of them achieve prolonged abstinence. Current concept suggests smoking that smoking is a chronic relapsing disorder. Next slide, please. The goal for therapy is to induce a remission that is as durable as possible. However, the clinician needs to be prepared to re-induce remission in the event that relapse occurs. And the smokers who quit should be kept in active surveillance, and relapses should not be regarded as a failure. Health consequences of smoking and health benefits of cessation must be explained to all of them. Next slide, please. Clinician must inquire about smoking and assess magnitude, intensity of smoking, and willingness to quit at every visit. As with management of any complex disease, the smoker should undergo organized assessment, and motivation or reason to quit and patient's confidence in their ability to stop smoking, that is self-efficiency, should be assessed by the clinician. Next slide, please. The intensity of addiction can be assessed with the Pakistan Storm test for nicotine dependence. And the most important question is time to first cigarette, and smokers who smoke within 30 minutes of awakening are usually heavily addicted to nicotine. And these patients are those with score more than 7, comprise a group of individuals likely to benefit from nicotine replacement therapy or varenicline. Next slide, please. Items and scoring for this very test for assessing the nicotine dependence. This is the first question, second question, and third question. All questions must be asked, and and, and the points as per the answer must be allotted to the and collected. Next slide, please. These are the question 4, 5, and 6. All these must be taken into consideration for assessment and evaluation for going further how to deal with these patients. Next, please. In contrast, patients with low Pegastom scores who are able to cope with a smoke-free environment for an extended period of more than 4 hours without developing discomforting withdrawal symptoms may not require NRT or nicotine replacement therapy. Next, please. These are the symptoms which are seen in the nicotine withdrawals regarded as the nicotine withdrawal symptoms, that is dysphoric or depressed mood, insomnia, irritability, frustration or anger, anxiety, difficulty concentration, restlessness, decreased heart rate, increased appetite or weight gain. Next, please. General clinical guidelines for prescribing pharmacotherapy for smoking are: in general, all smokers trying to quit smoking should be offered pharmacotherapy. There are 7 first-line anti-smoking cessation medications, 5 types of nicotine replacement therapy, sustained release bupropion and Vaseline, or the combination of nicotine patch plus the Lipitum short-acting nicotine products appear to be the most effective. However, the choice of first-line therapy should be governed by the patient preference, familiarity of the clinician with the medication, contraindications for the specific patient, and prior experience of the patient with specific pharmacotherapies. Second line therapies include clonidine and nortriptyline. These should be reserved for individuals with the contraindications or to failure to respond to first line medications. So, next slide, please. Bupropion and NRT may delay but not prevent weight gain after smoking cessation. It is recommended that patients start or increase physical activity, but strict dieting is discouraged because this appears to be the likelihood of relapse to smoking. Patients should be reassured that weight gain after quitting smoking is self-limited and poses much less of a risk to health than smoking. All first-line therapies appear to be safe for patients with chronic cardiovascular disease. The over-the-counter NRT therapies, the gum, lozenges, and patch, contain precautions for use if the following exists. That is the recent 2 weeks myocardial infarction, serious or underlying arrhythmias, or serious or burgeoning angina pectoris. This labeling is for the over-the-counter use only. Bupropion and Vaseline are likely to be safer than smoking in presence of cardiovascular diseases. Next, please. In individuals with prolonged withdrawal symptoms or those who are unable to abstain in absence of medication, extended use or long-term therapy with NRT, bupropion or Vaseline appears to be safe and effective therapy. Next slide, please. Next, please. These are the first one slide back. This is the first drug about whom I was talking. That the bupropion, sustained release precautions for the use of this drug is current or history of seizure, current or history of eating disorder. Adverse effects are insomnia, dry mouth, neuropsychiatric symptoms, rare, that is rare, and dose is 150 milligram every morning for 3 days, then 150 milligram twice daily. Begin treatment 1 to 2 weeks before quit date. Avoid bedtime dosing. And the duration is 7 to 12 weeks, and this is available in market on prescription of a clinician only. Next slide, please. This is the second drug, varenicline, and for this precaution is renal impairment. We must assess the patient for the renal impairment. Adverse effects are severe nausea, trouble sleeping, abnormal or vivid strange dreams, neuropsychiatric symptoms that is very rare, and the dose is 0.5 milligram per day for 3 days, then 0.5 milligram twice daily, then 1 milligram per day, and this should also be started treatment 1 week before the quit date. If we have asked anyone to start to quit the smoking on 15th, then we have to start this very drug 1 week before in the quit date. And the duration is 3 to 6 months, and this is also available on prescription of a clinician. Next slide, please. This is nicotine gum. Precautions, temporomandibular joint disorders. We must observe for that. Adverse effects, mouth and throat irritation, dyspepsia and hiccups. And though the first cigarette, as already we have discussed that we have to assess how the patient is dependent on the nicotine. If the first cigarette more than 30 minutes after waking, 2 milligram. First cigarette more than less than 30 minutes after waking, 4 milligram, and up to 24 pieces per day. And duration is 3 months and available OTC over the counter. Next, please. Nicotine lozenges. This there is no different precautions already discussed in the gum, and mouth and throat irritation causes irritation, dyspepsia, and this in this also, if the more than 30 minutes is first cigarette is duration is more than 30 minutes after waking, then 2 milligram. First cigarette less than 30 minutes after waking, 4 milligram up to 20 pieces per day, and 3 months duration OTC available on OTC. Thus, the dependence on the nicotine must be assessed in all those patients. Next slide, please. Nicotine patch is in this. There may be precautions must be taken in patients with skin diseases such as atopic or eczematous dermatitis. Adverse effects may be local skin reactions and insomnia, and those if the patient takes more than 10 cigarettes daily, 21 milligram per week, then 14 milligram 2 week, then 7 milligram 2 week. Less than if patient is taking less than 10 cigarettes per day, then 14 milligram 6 week, and then 7 milligram for the 2 week. This is available OTC over the counter. Next, please. Nicotine inhaler. In this precaution must be taken in the cases of bronchospastic diseases. Adverse effects are mouth or throat irritation. Dose is 6 to 12 cartridges per day, and duration is 3 to 6 months. Available on prescription of a clinician only. A nicotine spray. Chronic nasal disorders, because we must take precaution in chronic nasal disorders, including rhinitis, polyps, and sinusitis. Adverse effects are nasal or throat irritation, ocular irritation, tearing, and sneezing. Dose is 6 to 16 milligram 60 cartridges per day for the 3 to 6 months. Available on prescription only. One in case of nicotine nasal spray, one dose barabar one spray in each nostril, 8 to 40 doses per day may be taken. Maximum of 5 doses per hour or 40 doses per day. The duration is 3 months and it is available on prescription only. Next slide, please. These are the second line drugs, the clonidine, and the precaution is rebound hypertension. Adverse effects are dry mouth, drowsiness, and sedation. Dose is 0.15 to 0.75 milligram per day, and duration is 3 to 10 weeks, and availability is prescription only, oral formulation outlet. Nortriptyline, in this case, the precaution must be taken that since there is risk of arrhythmia. Adverse effects are sedation, dry mouth, and dose is 75 to 100 milligram, and duration is 3 months, and this is available on prescription only. Next slide, please. Cystine, a plant-based alkaloid, targets nicotine dependence by binding to the nicotine acetylcholine receptors with high affinity, and recent trials have demonstrated significant improvement in smoking and abstinence and reduced cravings for the nicotine. this drug is also being used. Next, please. In addition to causing cancer and COPD, smoking increases the risk for other pulmonary diseases, including respiratory infection, including pneumococcal pneumonia and tuberculosis, asthma, interstitial lung disease, and acute respiratory distress syndrome. Next, please. Smoking also increases the incidence of cardiopulmonary complications after surgery and in critically ill patients. The smoking causes 20% of cardiovascular deaths and increases the risk of peptic ulcer disease, diabetes mellitus, and osteoporosis. Second-hand smoke causes tens of thousands of cardiovascular deaths and several thousand lung cancer deaths annually. Next, please. Electronic cigarettes deliver nicotine in an aerosol of propylene glycol, vegetable glycerin, and flavorings, and use has increased over the last few years. The risk of e-cigarettes and potential benefits in smokers remain controversial. Next, please. Nicotine is an intensely addictive material that causes upgradation of nicotine cholinergic receptors in the brain. And nicotine has a short half-life and withdrawal symptoms may be severe. Most smokers would like to quit smoking but have difficulty in doing so because of nicotine addiction. Next, please. Smoking cessation counseling and medications are extremely unutilized or underutilized, we can say. The smoking cessation medications are available, and nicotine replacement therapies and oral medications both are available, and both individual therapies and combinations are very effective. These cigarettes are not recommended as a smoking cessation tool. Next, please. Our role as physician includes discouraging smoking initiation among younger patients, encouraging and assisting in smoking patients to quit, and participating in social efforts designed to reduce smoking at various levels. Next, please. Thanks, and stop smoking now. Thank you, sir.
Uh, Thank you, Dr. Mishra, Professor Mishra, for the excellent deliberation.
Thank
And
you, sir.
I don't think there is any question in the chat box. So, as a friend, I would like to ask you, sir, if the patient of smoking or addicted patients, they do not listen your advice, they do not listen. It is, yes, our duty to every time, every encounter in the clinic, we shall ask him about the smoking history, and then you persist it, allow him, assist him in all age and other things, and even the drugs not working, not again compliant. What you will do? What is
Sir,
your advice?
if he will not follow the advice, then what we can do? We must
So,
convince him.
will you do you think that setting up clinic,
Yes, sir.
non de-addiction clinic for
Yes, sir.
them? Yes.
We can send him, but first of all, de-addiction clinic are available. But I think how they are managing, I don't know. But if the patient is not ready to follow your advice, even after giving all the facts, I have discussed all the side effects of the smoking, cardiovascular disease, and risk. Even then, he will not accept. Then only we must send him to the de-addiction clinic. There is no problem.
As a part of the clinician, we have to advise to see that what are the benefits of if you say there is
Yes, sir.
cessation of smoking, or if you quit the smoking, you will live longer life. You
Yes, sir.
don't have will not suffer from cardiovascular disease, respiratory disease, smoking. They know whatever that side effects or
Sir,
disease
in one of
they are causing.
sir, in one of my slides, I have already told if patient if is going for the major surgery or hospitalized in the in for the surgical procedures, that very time is very important time when we can convince him that we have to you have to stop smoking. Otherwise, your operation will be complicated. Your and you will not be recovered properly. and that at that very time the motivation is very high. Okay, sir. I think ultimately, if
Thank
anyone
you.
not accept your advice, then only we have to send him to the uh, rehab clinic or de-addiction
Is
clinic.
there any question in the chat box, sir? Is there any question in the chat box? So if it is no questions, then thank you very much, Dr. Professor Mishra, for your deliberation, and hope that our delegates have enjoyed his deliberation and talks. And thank you very much. Good night.
Okay, thank you, sir.
Thank you.